Hello, Facebook family. Well, we thank you so much for joining us today. Want to bring you up to speed on some developing news that we are following here. I have Dr. Dean Blumberg from UC Davis Children's Hospital with me today. We're bringing you in to chat with us because we're seeing here that 2 cases of measles have been confirmed in Sacramento County, according to the Sacramento County Public Health. Now, we're told that before 2019, the last measles case reported in Sacramento County happened back in 2012. And that was only 1 case reported that year. And so we've got a lot to go through. I've got my phone here, so if you've got any questions on Facebook, be sure to let me know, and we will try to get those questions answered for you tonight. But the main thing I want to talk about is we have folks writing in, even as we speak, and Denise says, you all are worried about 2 children who came down with a rash? She says. Yeah. And Denise isn't the only one. I mean, we keep hearing people saying, why do you guys keep talking about this, suggesting that perhaps we're doing some type of fear-mongering. What do you say to folks like Denise Marie?
So there's 2 main things. First of all, measles is not just a fever and a rash. So measles, about 30% of patients with measles have complications, and that can include dehydration, it can include pneumonia and hospitalizations, and then 1 out of every 1,000 cases is going to die. So I don't think that's just fever and a rash. I take that very seriously. And that's one aspect that we take it seriously. And then the other aspect is this is one of the most contagious diseases known to humankind. And so the number of people that one person can infect on average is 15. So this could lead to an explosive epidemic. So it's appropriate for public health to jump right on these cases and try to limit spread.
So then what are the symptoms? What should people look out for when we're talking about measles?
Yeah, so the tricky thing about measles is the way it starts is just kind of like a cold. So cough, runny, itchy eyes, runny nose, and a fever. And people are contagious for 4 days until the rash occurs. The rash is really the first sign that healthcare providers are going to start thinking about measles.
So you're contagious 4 days before you even start showing signs of it.
Right, exactly. And then the other thing about measles that's tricky about contagion is that you don't even have to have face-to-face contact with somebody. It's transmitted by these very small particles that remain aerosolized. They remain in the air for up to 2 hours after somebody leaves the room. So you don't have to have face-to-face contact with an ill person. You could just walk into the room an hour later and you could get measles. So that's why we worry about it.
Sue Harris, we thank you for your question. She wants to know, can we contract this even if we were vaccinated?
So no vaccine is 100% effective, but measles vaccine is one of the most effective vaccines that we have. 1 dose provides 97% protection. 2 doses gets you up to 99%. So if you've been vaccinated, if you're up to date, you're pretty well protected, but I can't guarantee you're 100% protected.
We have seen not just Sacramento County, but Placer County Public Health investigating 3 cases of measles in 1 family in connection with recently reported cases in Butte and Tehama counties. We should stress that in Sacramento County, that this family that we're dealing with, this measles case, had recently been on some type of international travel, according to health officials, and they said that there is minimum risk of exposure to the public in that case. So that is a bit of good news there.
Right. So it sounds like what they've done is they've made sure that all the contacts that these 2 people have had when they're infectious, that all the contacts they've had were probably immune to measles.
Sandy Garner, we thank you for your question, Sandy. Sandy says, if you were vaccinated in the 60s or 70s, are you still okay?
If you've been vaccinated against measles, if you're up to date, you're likely immune for a lifetime.
Okay, that is good news as well. So what should people do if they think they have come into contact with someone with measles?
So if they think they've come into contact, then they should call their healthcare provider. Make sure they're up to date on their immunizations so that they're immune. If they're not immune, then their healthcare provider may want to make sure that they stay isolated so that they aren't contagious to anybody else during the incubation period, so that limits spread.
We saw a county in New York had banned unvaccinated minors from public places so that they can try and contain a measles outbreak they're seeing there. We're seeing this outbreak really across the country with more than 20 cases here in Northern California, if I'm not mistaken. So talk to us. I know you're saying as early as tomorrow there is some movement here in California. Talk about that.
Yeah, so one of the bills is going to be heard before the Senate Health Committee is SB 276, and it's by Senator Pan, and it will limit the exemptions for required vaccinations for school. And the idea is, what we've noticed is that there have been some basically rogue doctors providing medical exemptions that no mainstream doctor would provide. And so what it's going to do is require the California Department of Public Health to review all the medical exemptions to make sure they're appropriate by mainstream standards, by Center for Disease Control, American Academy of Pediatrics, and other mainstream doctors. So I'm sure that's going to be a very contentious issue, but we want to make sure that all children who are vaccinated get vaccinated, children who have medical reasons not to get vaccinated, that they don't, and trying to increase protection for all.
Okay. Laura Fry has a question. She says, do you get in trouble if a child is not vaccinated?
So the vaccines there's certain vaccines that are required for school. So if parents don't want their kids vaccinated and there's not a medical reason for that, they won't get in trouble, they just won't go to school. So they can be homeschooled is the option for that.
Facebook family, we thank you so much for joining us. We're talking with Dr. Dean Blumberg from UC Davis Children's Hospital. This as we are getting more information about 2 cases of measles that have been confirmed in Sacramento County, according to the Sacramento County Public Health. We're told that before 2019, the last measles cases reported in Sacramento County happened back in 2012. One of the other things that we're seeing today is that both diagnosed cases were found in the same family who officials say had a recent history of international travel. Anything that we should take away from that, Doctor?
So I think what we're seeing in the U.S. and California is that what we're seeing is cases that are introduced into the U.S. are acquired via international travel. So people go to areas in the world where we know there's more measles transmission. So, for example, to Ukraine, Poland, Thailand, France, other areas that have low vaccination rates, they come in contact with somebody, they're susceptible, they get measles, they come back here, and then, if they just get measles and it's limited, that's what we hope for, but the danger is that they have contact with other people who are susceptible, and these can cause these localized outbreaks.
Okay, so you were saying that the real concern here is not just that this is some rash. You're saying that there is cause for concern, especially here in California.
Yeah, absolutely. So people are hospitalized with measles, and we don't want people who are more susceptible to complications, such as kids who are very young, or kids who can't get vaccinated for other reasons, like they have cancer or other reasons that their immune system wouldn't respond to the vaccine. And if they get measles, it can be a disaster for them and be a real tragedy. So that's why we really need to maintain a high rate of immunity against measles to limit transmission.
And so then when we had you on just a few weeks ago, you were saying that here in California especially, there are large pockets of communities who choose not to vaccinate.
Right.
Why is that, and what message do you have for those folks?
So what we have is overall the immunization rate is very good in California among California school children, but we do have these counties, some counties, like, for example, Placer, Sutter, Trinity County, that have relatively low vaccination rates. And then even in counties that have high vaccination rates, there's communities or school that have a very high rate of medical exemption and low vaccination rates. And the worry is if you introduce measles into one of those schools or communities, it's just going to take off like wildfire and really spread. And so people need to know how serious measles can be, and that vaccines are safe and effective, and that measles vaccine is your best protection against disease.
You know, as I mentioned earlier, some of the things that a county in New York was doing, banning folks. Do you see something like that happening here? It's not clear how they even go about doing that.
Yeah, I don't understand the feasibility of that either. I mean, in California, I think the best way to do it is we do have the school system, and so the school system checks for vaccines. And that's to make sure that school is a safe and hygienic environment for children.
Facebook family, keep in mind we are answering your questions now. If you have anything that you want us to try to get across to the doctor here, he's more than willing to chat about that, especially as we look to this movement that we're going to see at the state level as early as tomorrow, you're saying, where we're starting to look at whether or not people ought to be able to get exemptions as easy as they have been able to, you're saying.
So they'll be able to get their exemptions from their regular physician, and the exemptions then will be reviewed by the California Department of Public Health. If something looks fishy about it, if it looks like it's outside of the mainstream, then they're going to want clarification on that.
Okay. Anything else that we should take away, doctor, as we start to see these cases happening really across the country, and especially now right in our own community?
Yeah, there's been more cases reported in the U.S. this year so far compared to last year, the entire last year. So we are having these small outbreaks due to international travel. It is a danger, and it would be great if people could make sure that they're immune and protected against this disease.
Okay. Well, we thank you so much for coming in with us this evening to chat with us. If you have other questions, please let us know. We'll try to share those with the doctor and get those answers for you tonight, coming up at 11 on Late News Tonight.
Great.